Hey everyone, welcome back to my channel. It's Dr. Alessandro. Please like and subscribe. In this video, I'm going to be talking about this edition of JADA, and that is the Journal of American Dental Association. And it's specifically talking about our restorative materials, or filling materials, which release these quaternary ammonium compounds. Now, these are antibacterial compounds in filling materials. So, interesting concept, possibly even maybe useful. But I do want to make some important notes about this for you all if you're interested and you're wondering, hey, maybe there are filling materials that can block bacteria and can remain in the mouth longer. So whenever we talk about research, some studies are done what we call in vitro, that is in a test tube or in a laboratory type of setting. Now, it's great that you can show some activity and some results in a laboratory setting, but a laboratory setting is basically, to me personally, almost worthless when it comes to the mouth, because the mouth has so many variables in it that a laboratory source just simply cannot replicate that, not even come close, let's be honest. So if you're going to talk about in vitro studies, which some of the studies in here are in vitro, then you may as well just take it and toss it out the window, because it means nothing. Now, some of the studies, though, in that article are actually in vivo. That's much more significant. So in vivo means it's being done in an actual living organism, so it could be a laboratory animal in some cases. But in this case, there were some studies that were human studies. And so what was found? Well, it says that they're effective. Yes, now asterisk. It says they're effective, but it didn't give you a time frame. Now, some of the studies were 4-week studies, and it showed that these filling materials had, the antibacterial properties or activities were still active after 4 weeks. Okay, that's a start. A month. You get a month of activity. I mean, but if you're going to have like a $150 filling place and it works for a month, I'm not exactly sure how effective that is. Well, the other one actually went in and went longer. It went for 6 months. Okay. 6 months. 6 months where this material is releasing these compounds that are antibacterial, and so it is basically reducing the incidence of decay around the margins of the filling. Hey, you know what? 6 months is pretty good. Okay, so it's better than 4 weeks. But nevertheless, again, if you're paying that amount of money for a filling, you're going to want a filling to last a long time. And our tooth-colored filling materials are really, really, really notorious for failing in a short period. Numerous studies have shown that they tend to fail within 5 years. And the causes of failure typically are, recurrent decay. So a lot of the times, decay kind of starts to break down, or bacteria break down at the edges of the filling and the tooth, and then the bacteria enter the tooth from there. So that typically happens within 5 years, folks. That's not a very long time. That's for your tooth colored. Silver takes a lot longer. So your silver fillings, your amalgams, some people call them mercury amalgams, just to put the fear into people. They tend to last a lot longer and work a lot better long term. Now, I know some people will take issue with me on that. They always do, but it's the truth. So tooth-colored filling materials, as long as they start to incorporate these antibacterial properties, may improve and may last longer. We hope. We'll see. That's the hope of whoever was developing these and then testing them. And, 6 months, okay, hey, that's a decent start in vivo. That's good. But we'd like to see it more like the 10, 15, 20-year mark and not just the 6-month mark. So that said, hopefully this is going to improve the tooth-colored filling materials as a whole, because as of right now, unless a person had the tooth-colored filling material placed under something called a rubber dam, which is excellent isolation, and is a daily brusher and flosser, can't repeat that enough, those fillings do tend to break down and fail within 5 years, maybe 10 at the most. So unless they're perfectly placed and perfectly maintained, they don't tend to do well over the long haul. So that said, maybe these new materials will improve the longevity. We're hopeful, and hope you're all staying well and healthy. Thank you for joining.